Hi, everyone, and thank you for joining today to listen to this presentation. My name is Brianne, and I'm a program specialist at Expecting Health. I have the great pleasure of working on all of our different newborn screening programs and projects. So I'm going to talk a little bit more about our approach to using more engagement and better education for a connected newborn screening system. Here's a bit of my agenda for this presentation. First, I will share a little bit about who we are at Expecting Health and our approach to education. Then I'll move into providing an overview of what we do and how we engage various newborn screening stakeholders. Then I will highlight the why. Why do we engage all of these different stakeholders, and what role does this engagement have in our newborn screening education? And then lastly, I'll talk briefly about our plan for the future and how we can continue to utilize this education and engagement to create a connected newborn screening system. Expecting Health is made up of key leaders in health communication with a strong passion for bridging scientific information with the everyday realities of parenting experiences in family lives. Our goal is really to create resources and education for families informed by data and science. Here on this slide, I have our organizational vision and goal. Our vision is that the fear and confusion individuals and families face during pregnancy and parenting is replaced by confidence and agency to make the best healthcare decisions for their lives. And our goal is to alleviate pain points, pressure, and confusion faced by families planning and/or experiencing a pregnancy and during those early motherhood years. One thing in common between our vision and goal is that engagement and collaboration is key to both. We need to fully understand the realities of families' day-to-day lives, their worries, priorities, and needs in order to address them appropriately. So our approach, we use these 5 key activities: engagement, technical assistance, user experience testing, advocacy, and communication science to approach our vision and goal. With a focus on newborn health, we utilize principles of community engagement and user-driven design to reach diverse audiences. So let's get into what our newborn screening activities and programs are. Let's start by giving a little overview of all of our newborn screening programs and activities. Probably the one those here recognize the best is Baby's First Test. When you think of Baby's First Test, you might immediately think of our website, but we also do a lot of online engagement activities like webinars, as well as have many social media accounts as Baby's First Test as well. Navigate Newborn Screening is another one of our programs and is also known as the Newborn Screening Family Education Program. Through Navigate Newborn Screening, we do family education online, in person, and also do a lot of family engagement around newborn screening. Through the National Genetics Education and Family Support Center, we develop genetics resources and support primarily around newborn screening conditions, and we also engage with families around genetic conditions. One of our last newborn screening activities is our technical assistance and content development. We are lucky enough to provide technical assistance to state programs, federal projects, research projects, and other groups as well. And here are the funding disclaimers for the National Genetics Education and Family Support Center and Navigate Newborn Screening. I just want to give a huge thank you to our partners at HRSA for supporting us to do this work. So when we think about more engagement, I want to focus on it being more quantity and quality. We want our engagement around newborn screening to be more meaningful, more diverse and equitable, and more beneficial and accessible to all stakeholders. So at Expecting Health, we like to think of our engagement as a spectrum, and no certain part of that spectrum is more important than any other part of the spectrum. And there's certainly value in one-time engagement and ongoing engagement, and we appreciate all different types of engagement equally. So just with this in mind, we can start moving to think about who we engage. In the context of the newborn screening system, we engage all sorts of stakeholders. We engage patients living with newborn screening conditions and certainly newborn screening condition specific and rare disease advocacy organizations. We also engage parents of children with newborn screening disorders, new parents and expecting parents. We also engage a wide variety of healthcare providers, including pediatricians, genetic counselors, geneticists, etc. This list is certainly not all inclusive. And then we also engage with the state newborn screening labs and health departments, education and research groups, and federal organizations. So that is the long way of saying that we engage with anyone and everyone who has an interest in newborn screening. And everyone's perspectives are so incredibly valuable to the work we do. And I will get into a little bit about how they influence our education in a little bit. So when the COVID-19 pandemic started, we were kind of at a crossroads with our engagement, at which I feel like we were all at a crossroads with many different things at that time. We knew that we could, for at least the meantime, no longer safely convene or engage with our stakeholders in person. And so we really had to develop new strategies to make even the smallest opportunities for engagement as meaningful as possible. And so with the context of virtual engagement as our new normal, and we know that it could be for some time, I have new normal in parentheses because it doesn't seem new anymore as it's been over a year, but it is still certainly kind of new. How do we keep our engagement meaningful and beneficial for everyone, knowing that we are now convening almost exclusively virtually? We certainly want to think about how we are or are not reaching new groups with our engagement. And we want to make sure that we aren't excluding certain groups of stakeholders with this type of engagement. So 2 key strategies to make sure that we're using this to our full advantage are to make even the smallest engagement meaningful and to encourage engagement by meeting stakeholders where they are. And we're going to use a case study of one of our engagement events from earlier this year to kind of talk through how we use these strategies to make sure that we're still engaging our stakeholders and making the most of what engagement we can have. In March of 2021, we hosted a webinar titled Breaking Silos, Building Systems, Congenital Cytomegalovirus and Newborn Screening, with the goal of convening stakeholders in newborn screening and CCMV prevention to discuss current strategies and future opportunities for collaboration between the two. We had 192 registrants for this webinar from a wide variety of stakeholder groups, including families, advocacy organizations, state newborn screening program representatives, healthcare providers, industry representatives, and more. So webinars and virtual convenings are no longer, in our eyes, just for us to share information with others. They can really be engaging experiences for presenters and audiences together. So let's take a look at make even the smallest engagement meaningful first. We take every opportunity to gather perspectives from our stakeholders. One of the ways we did this was through our webinar registrations and participation. And since convening online was our only option, we really needed to make sure that our audiences were getting the most out of it and we were giving them the information they wanted. So this question here on the screen is an example of a question we would ask during a registration, and our audience could respond to these if they like to. We have some that are optional and some that are required, and we did find that even when we make them optional, the audience is really interested in sharing their perspective and sharing their feedback with us. So we do make these questions intentional, but it's a great opportunity for us to get this feedback and shape our event to what the audience is looking for. Additionally, we asked these two questions here on the screen to encourage engagement by meeting stakeholders where they are. Nobody wants to go to a webinar or event if they're not comfortable with the content that's being shared. And so that makes it easier for us to share information that's relevant to our stakeholders. And when we say meet stakeholders where they are, we really want to encourage you to think beyond just how we engage, but also who they are, where they are, how they are, thinking of how in comfort level, knowledge, interest, capacity, and when they are available. So time, for example, families might be available at different times than other stakeholders too. So we noticed that many of our participants in this webinar were there to listen and learn. So we did structure it to have a little bit less time for discussion than we would have normally had and provide more opportunities for learning. But we also make sure to provide those opportunities for those that do want to share their perspective or brainstorm solutions. And we do this through the chat box, a live Q&A session, and also allowing those who attend to submit questions or thoughts anonymously through email or the form on Zoom. So using our engagement to shape the opportunities and information we provide to families is key. We want our education to be current and accurate, accessible, and make sure that it addresses families' needs. So 3 key strategies that I would like to highlight to do this are to find ways to bridge the gaps, meet families where they are, and continuous engagement for better education. You'll see that engagement for education is kind of an ongoing theme here, but we'll really see that in the 3rd strategy. So the first strategy is to find ways to bridge the gaps. This diagram here shows that when talking about newborn screening results specifically, we often hear that parents and families are more comfortable with the word normal, or that is a word that they're familiar with. While we know in newborn screening that in range is a more widely accepted or appropriate term for talking about a normal or in range result. And something that we encourage is finding ways to bridge that gap in language. While we might want to lean towards saying in range because it may be more accurate, a first-time parent that is just having their first child, going through just hearing about newborn screening, in range might not be something that they're comfortable with. It might be a foreign term for them. So really bridging that gap by saying normal or in range, or really explaining what in range means by saying this typically for another test is known as normal. So don't shy away from the words that bridge that gap in education and vocabulary. Meet families where they are. This is kind of similar to meeting stakeholders where they are, but we like to say if you find a way to properly educate one family, you've found a way to educate one family. No family is the same, and everyone has different needs when it comes to education, whether it's prior knowledge at varying levels or language, any type of constraint on education. So we use different methods of education to reach families with newborn screening information. We're active on all social media, including Facebook, Twitter, and Instagram, to reach families. We also utilize print materials that are distributed by newborn screening programs and partner organizations, and online modules to educate families through Navigate Newborn Screening. And we also are now educating families in person. One of our current education efforts that we're extremely proud of is the Newborn Screening Family Education Program pilot at LBJ, a clinic in Houston, Texas. We launched this pilot with the intention to bring prenatal newborn screening education to medically underserved populations in the Houston area. And this pilot consists of a flip book about newborn screening. And that flip book was originally just online, but we quickly learned that the moms in this clinic also wanted that flip book in print. So we adapted and now are proud to say that we're offering this flip book in an online format, a print format, and in the languages of English and Spanish to the moms at this clinic. And while we don't have all of the data analyzed yet, early looks tell us that the book is successfully increasing awareness and knowledge of newborn screening. So continuous engagement for better education. The best example we have of this is our state outreach through Baby's First Test. State information is so key to newborn screening education. And a lot of us already know that newborn screening is so different across all of the states. So the best way to provide families with current and up-to-date information about newborn screening in their state is to ask the states. So each year we reach out to all of the states and territories and ask them to provide us with updates to their website. They give us updates of the best name for conditions in their state, what conditions are on their state panel, and their contact information, and obviously much more. We're currently wrapping up our state outreach for this year, and all of the states we've reached this year have had edits to their website. And I think that is a great example to say that newborn screening is always changing. And the best way to stay up to date is to just ask who has that information and continuously engage with them over and over again and keep that relationship open. How can we continue our engagement and continue improving our education? And what does that mean for a connected newborn screening system, especially looking towards the future? So looking ahead, we're looking forward to further engagement and collaboration, and also to further partnership to engage around emerging areas of newborn screening. So the key to successful education is constant engagement and collaboration, especially in a system as complex as newborn screening. So the first thing we are looking forward to is Newborn Screening Awareness Month, which I hope everyone is looking forward to as well. We're very early in the month and there's so much going on. September is the month for newborn screening, education, and engagement. And I hope that we can all use this opportunity to engage with other stakeholders. You have all taken the first step by being at this summit, so that is great. And at Expecting Health, and I know many of our partners have so many events planned throughout Newborn Screening Awareness Month. So I encourage everyone to continue sharing their perspectives, educating others, and learning from others, and collaborating throughout the month of September. And then also we have a lot of other engagement and collaboration opportunities coming up, specifically through the National Genetics Education and Family Support Center and Navigate Newborn Screening. If you're interested in learning more about either of these projects, I suggest you reach out to my fantastic coworkers, Molly and Mariana. They have all of the information about these projects, but specifically through the National Genetics Education and Family Support Center, we have a diversity and inclusion work group around genetics that is a fantastic opportunity. And we are also working on amping up our Navigate Newborn Screening Ambassador program. So since families are such a key component of the newborn screening system, we really want to keep learning from them and connecting with them specifically through these two programs. And lastly, we want to partner to engage around emerging areas of newborn screening. We want to further our collaboration with states, laboratories, and other researchers so that our education can really be proactive and timely and not reactive. There are a lot of new conditions coming through the pipeline for newborn screening, specifically for recommendation to the RUSP potentially. So we want to make sure that we're able to provide families with accurate and accessible education around those conditions as well. And we also want to create a space for an open discussion around those disorders, like we did with CCMB, and we want to continue doing so. So engagement and education have a bi-directional relationship, and we want to keep making sure that our engagement is beneficial for our education and that we can continue to convene and engage around our education as well. And we can all continue to work together to provide families with the best newborn screening education possible. So that is all I have. Here's my contact information, and you can connect with us on any of the social media, but I welcome any questions or comments or thoughts now, or you can email me. So thank you very much.